Everyone. Welcome to the second Directors Seminar of the year. My name is Henrietta Moore and I am the founder and director of the Institute for Global Prosperity. It's the same organization as usual, so we will have our guest speaker, whom I will introduce in a moment, followed by an interchange between me and the guest speaker, and then the floor is open for you to ask your questions. So I've been asked to remind you to use the question and answer button to get your questions into the system, and we're looking forward to hearing what you have to say. So please start thinking about your questions right from the very beginning so that we can get a conversation going between all of us. So it's my very great pleasure this afternoon to welcome Dr. Rochelle Burgess, who is lecturer in global health and deputy director of the UCL Center for Global Non-Communicable Disease within the Institute for Global Health here at UCL. She's a leading community health psychologist who specializes in community-based approaches to health. And her work studies the social and psychological dynamics of community engagement using qualitative, participatory, and transformative methodologies. She's interested in the promotion of community approaches to health globally and views communities as a route to understanding and responding to the political economy of poor health more generally. For the last decade, she's focused largely on mental well-being and on the experience of common mental disorders. She has led a range of projects across the world, in South Africa, in Colombia, in the UK, and in Zimbabwe. And she's come today to talk to us about community in the context of the Covid-19 recovery, pitfalls and possibilities. She's going to talk a little bit about what is community in this context, what are the kinds of experiences and intersections that link us all together as academics and scientists, as sons and siblings and service users, all the kinds of identities we have that make up the communities we're part of. The notion of community is complex, and she's going to talk to us about how that complexity has worked its way through the experience of the pandemic. And she's going to also talk to us about what are the possibilities for change and where we could perhaps make things work for the better. So let me start, first of all, by welcoming Dr. Burgess. Dr. Burgess, welcome to the IGP.
Thank you very much, Professor Moore. It is an honor, and I'm really, really excited to be here talking about something that is so close to my heart and my family is very tired of hearing me talk about. So it's nice to expand the audience as much as possible. I will now try and share my slides as seamlessly as possible. And then we can get started. So am I okay? Nod, because I can still see you. Yeah, perfect. All right. So thank you so much for having me today, to everybody who's joining us from wherever you are in the world, to reflect a little bit on a topic that I think probably many of us in this webinar electronic space would agree is a really important one. And as Henrietta has said, I've spent the last sort of decade or so of my life, basically the entirety of my academic life, studying the idea of community and what the ideas and practices and dynamics of this term, this space, this concept offers us in terms of health improvement, social change, and particularly in relation to groups that we typically describe as marginalized or excluded in many parts of the world. I am a community health psychologist, and I am in just one of many fields that work with this idea of community. But what I'm hoping to discuss today and to highlight today is what's particularly special about a community psychology approach is this anchoring and this positionality towards transformation that and all the opportunities and challenges that are bound up in seeking that aim. So if I were to tell you that all of us on this webinar, on this call, were members of the same community. Would you believe me? If your answer is yes, you'll enjoy everything. If it's no, I hope by the end of the next sort of 45 minutes or so, I will have changed your mind. Because the ability to push the boundaries of how we understand and engage with this term and this idea is what gives us the greatest possibility for change, particularly in the context of the current COVID-19 pandemic and the many challenges that it presents to us as scholars, as activists, as humans and citizens of the world. So for our time together this afternoon, I'm going to talk about three broad things. First, I'm going to reflect on the theoretical ideas behind this notion of community, looking closely at the way in which the term is mobilized within public health and what we can learn from how community approaches have worked or not worked in other contexts around sort of public health and global health crises. So specifically looking at the history, a brief, very brief history of community mobilizations in the context of HIV, and also reflecting on community engagement in the context of the 2014 Ebola outbreak in West Africa. Then I'm going to connect some of these ideas to COVID-19 and communities specifically in the UK context, and try to highlight and show how a lot of these ideas and sort of hurdles that we've seen in the past manifest in the ways in which we talk about community so far, but also highlighting some current policy spaces that have opened up in light of the pandemic that create really amazing opportunities and surprisingly positive rhetoric around what communities could be and how we can promote and support community engagement across many levels of action. And then finally, I will wrap up with talking about the sort of future of community, which is bound up in this idea of transformation and a community psychology approach to the notion of community. And I'll do that through reflecting on two case studies from the UK. The first is based on a recently completed piece of research that I've done with an organization in Southwest London, and looking at the experiences of young people from Black African, Black Caribbean, and Southeast Asian British backgrounds, and the accounts of their own life and survival these past months as we've been dealing with the pandemic. And the second is a collaboration between a collective of women's group in Southwark, which is led by Pause, which is a third sector organization who works with women with very complex histories of oppression and exclusion, and a range of other local women's groups in the area, including one particular leader there, which is the organization called Our Ladies of Virtue, and how they sort of mobilize around and break down barriers around communities in order to develop new ways of working. So one of the biggest challenges with community that I have seen and reflected on in my work over the past few years is it's created ultimately by what makes it special. So it's diversity, its ability to be all things, sometimes attributes to its ability to be nothing. And for the potentials to be wasted. So it's a level of analysis that occupies the interests of many different fields, health, education, local governance and local politics, geography, and of course, public health. And ultimately what we see in many of these spaces where these ideas are marshaled and leveraged is that the definitions of what community is often come from the outside. And for me, this is where the sort of the biggest challenges to begin to emerge, particularly because of this lack of consensus. So if we go back to some of the earliest scholarship on communities from 1917, work here very much talked about communities in terms of a shared geographical space and the dynamics of individuals coming together within a shared physical location, geographical location. And this main sort of discourse around community is one that has stayed with us across all of these different fields for the most part. Each field taking a slightly different angle to what the shared place means, or the tangibility of community. And as evidence and work advanced on this, another seminal study on community from 1955 attempted to try and look at consensus across all these different fields and the different language that we use to work around this idea of community. And I think if you were to take just one of these fields, and I'll use the field of health because this is my specialty, the notion of community links to many, many different ideas. So we have a community of service users, practitioner communities, communities as the sites for delivery of treatment and care, communities of place as sites that create certain types of vulnerabilities. And all of these things are very different in their manifestation, but we use the same terms to describe them. And so ultimately, what happens is that because of this ambiguity, this is where the external construction of what community means becomes so dangerous. We try to make sense of this ambiguity by just putting hard brackets in as much as we can. So activists, academics, politicians, third sector entities, we put the boundaries up. We ascribe labels to particular communities in order to help us grapple with it and make sense of it, often in a pragmatic way. And in doing so, this can potentially create as many problems as it solves. So if I was to use myself as one example, there are many assumptions that could be made about me from outside of me that ultimately try to ascribe community to me. So community of place is one of them. It's probably it's the easiest one in terms of public health approaches, in the sense that we find I live somewhere, I'm situated someplace. So I am currently situated in Hertfordshire. And what does that mean for my exposure to certain types of risk, for example? But I'm not from England originally. I was born in another country. I was born in Canada. So I'm similarly attached to an additional community of place. But my lack of physical placement there sort of moves that identity to something that's a bit more linked to the intangible. And that's where you sometimes get into communities linked to identity. So nation, the nation state, and my ability to, where I call myself a Canadian, no matter where I am, is created by the ability to build a community around a shared idea of what being Canadian means. There are many debates about that, how we separate ourselves from Americans, for example. Some of my favorites are hugs and poutine, but these are just a couple of ways in which that also highlight desires and needs to set boundaries around certain characteristics, even for people who belong to shared communities. There are other different protected characteristics which could potentially define who I am and then communities' ideas. And so here we're talking about things such as my sex. So I'm a hetero woman. I was born a woman, and so that very much shapes my experience of health services in a way that is different from somebody who may be a non-binary in terms of a gender identity. I'm also a woman of color, and what does that mean in terms of my exposure to certain risks? And you can see now that all of these sorts of communities start to intersect. I'm also a researcher and an academic. I belong to a community of practice that has certain values and methodologies for engagement in the world attached to it. But beyond that, I have personal experiences linked to who I am. I'm a partner and a wife. I'm a mother, I am a sibling, I am a daughter, I'm a daughter-in-law, and all of those different sort of dimensions of personhood also manifest and shape the ways in which I make sense about the world, the way I participate in the world. And so all of these things, all of these communities ultimately come together. And the reality is that when you try to think about community, then this is what you end up with. This is not what a practitioner or a policymaker would ever want to see, but this is our reality. Community for each and every one of us is very much about a constellation of communities, or some people in wider fields talk about networks and network relationships, but you are connected to various formal communities through institutions or training, informal groupings and collectives of people that often exist in intangible spaces like online. Our community now in this webinar of people from very different places brought together with a shared idea or interest into talking about community this afternoon. And there are lines and ways in which we connect and diverge. And so in many ways, this becomes both the possibility and the challenge for trying to work with community around change. But for me, I'm more interested in the possibilities that this creates. I think if we were to approach community as this complexity, you start to see the many ways in which we connect with each other. And it's these connections that can lead to development of new relationships, ways of thinking, modes of working, and the developing mobilization towards change in different areas in our lives. And so I think the only way that we can fully come to make sense of what community is and the best way to work with it is to start with definitions that just accept complexity. And so I work very much, as I said, in this tradition of psychology, social psychology, community psychology. And for me, one of the best definitions that I've come across looking across many different fields of sociology and public health is, and psychology is that of Caroline Howarth, who's a scholar from the LSE. And she talks about communities as the way that groups and collectives are talked about, constructed, and defended by those who reside in them and also come into contact with them. And by framing community this way, it assumes that what we mean by community is going to change dependent on who is talking about it. So we make sense of community by engaging with people who are living community. They live through it, through their experiences of various ideas and identities. And also those experiences are shaped by others who want to define what a community is for pragmatic policy or research reasons. And thinking about that as being in dialogue at all times means that we don't necessarily have to be limited by the complexity, but can be emancipated by trying to find ways to work through and take advantage of complexity of systems. So ultimately, in thinking about what all of this means in the context of the coronavirus pandemic, coronavirus and COVID-19, community and what we know about community and trying to work from community is not new. We have a lot to learn from previous global health crises and public health crises of the past, as I sort of suggested when we started. And I could talk about many. I work in global mental health and I could talk about it there. But I would like to focus specifically on two pandemics and spaces in time and history that have really captured and highlighted a real sort of thirst for and a belief in the power of community. And so a lot of this is seen within the HIV pandemic in sort of the first sort of 20 or so years in terms of mobilization for change around things like access to treatment and highlighting it as a global issue, or things like peer support programming, things like this. And then more recently, capturing our attention during the 2014 Ebola outbreak in West Africa. And what both of these experiences have to teach us about community is that we ignore complexity to our own detriment. So if I start in your top left corner with access to resources, and then I will work down and across, okay? So in terms of access to resources, I think ultimately this idea about the spirit of community and community activism and engagement often is rooted in a belief that people do things for the good of their own hearts and on our commitments to causes. But what we found and what has been shown quite conclusively across a wide body of research around community engagement in context of HIV particularly in the global south, is that community mobilization efforts rise or fall depending on the access that people have to resources, and the decisions that they make in the face of many competing challenges. So here we often talk about the ways in which structural realities come to bear on people's ability to participate in efforts for change. And these ideas resonate through many modern questions we ask about which groups are present or absent from big movements such as the climate change movement and things like that. And Catherine Campbell, who is Professor Catherine Campbell from the LSE, who is now emeritus professor, but still doing a lot of amazing work advancing our thinking around community mobilization. One of her seminal pieces of work called Letting Them Die remains one of the most compelling and powerful pieces of work I've written about what happens when you assume the homogeneity of this idea of community. We really sort of dwell and highlight on this positive idea and essentially overlook the ways in which different resources limit people's participation. And that very much links to this idea of power and our need to think about power in diverse ways in relation to communities. So it's not just recognizing economic or material constraints, but also thinking about how other forms of positional or symbolic power or exclusion around sort of normative ideas that hold power in various community spaces include and exclude certain groups from participating in activities for change. And so in her book, Letting Them Die, which is an examination of peer support programming in South Africa and sort of failed efforts around that, really highlights the ways certain actors within communities who hold a lot of positional or symbolic power act as barriers and gateways to accessing resources, to being able to deliver messages, to defining what the right message is for that should be delivered, and basically giving clout to an idea that allows it to move through a community and contribute to change. And so we know also within the context of HIV and AIDS that certain groups are often more excluded than others. So in many parts of the world, there's ongoing exclusion around certain groups such as sex workers or transgender groups who exist on the sort of fringes of geographical spaces and social spaces because of the norms that exist around various identities and their experiences and their lives. And so there is a lot of work that needs to be done to shift ideas in order to enable them to be able to access the positive benefits of mobilization and community work. If we flip now to talk about the Ebola outbreak in 2014, one of the things that was highlighted in Paul Richards' ethnographic work on Ebola in Sierra Leone highlighted the ways in which many local sites throughout the country were filled with community members and actors who were mobilizing in response to the outbreak long before sort of foreign engagement and sort of development actors began to move in and began to sort of put a structure around what should and shouldn't be done to respond to the pandemic. And in one of the saddest accounts from that particular book was the ways in which that external engagement in some cases derailed successful efforts that had been keeping cases of Ebola quite low in some parts of the country. And so then the reality of this is that a lot of assumptions and pre-existing assumptions about communities of space. So for example, we could think about Sierra Leone as a country that has experienced civil war that has led to fractured health systems. They've also been subject to structural adjustment policies that resulted in reduced funding to a range of social sectors, including healthcare, which put them at a very weak point when that crisis hit. And so then the reality, but beyond that, is if we look beyond the realities of that geographical space, we often can see that people survive, and this survival, rather than being the starting point, is overlooked because we are bounded by what the reality of space tells us as our only thoughts around community. And then related to both, both sort of public health crises is this idea of the importance of trust, and examples of communities that are hesitant or unwilling to engage with certain services or other groups because of histories, longstanding histories of exclusion or oppression. So why do certain groups choose not to take up a service is often rooted in people's historical experience of that service. And I think that's something that I've seen resonate across many different spaces of my work in mental health in the UK, for example, looking at sort of disproportionate and unequal experiences of the mental health care system between, for people of Black, African, and Black Caribbean heritage. So if we move now to think about what we've seen in the UK and the language around communities, it's a term that for me has been almost synonymous with how people have been talking about things. They are either to blame for bad behavior. So there's lots of discussion about certain groups of young people being irresponsible, doing risky behavior that puts lots of people at risk, or being used to champion and celebrate people for their commitments to supporting each other, or thinking a little bit about, you know, how we make sense of risk. And so basically in each one of these sort of different manifestations, we see a lot of these other limitations emerge. So the debates and challenges that have sort of occupied current public discourse about these staged approaches to lockdown in different geographical communities, which really overlook nuanced behavior of different groups and community organizations within these places that might place them at more or less risk. And so we almost create blanket policies for different parts of the world, or different parts of the country, which ultimately gives us an inappropriate assessment of the actual risk that people face, because we stick just to the level of community division, as community as a geographical space. Of course, there's discussion about healthcare communities, and lots of discussion about how we try to, for example, protect frontline workers, and thinking about the ways that we have been called on to celebrate and clap for our NHS and clap for our care workers and our frontline service workers who maintained and sustained us all, very much trying to recognize commitments of certain groups and highlight their efforts, linking into this a very similar idea of the community spirit, where community emerges as this feeling, this idea of civic duty, a commitment or spirit of togetherness. So the intangible dimension of the community comes out here, and this community spirit also manifested quite tangibly, organically, without intervention from the government or state, in the shape of mutual aid support groups across the country. Now there are over 2,000 of them across the United Kingdom. A very clear example how, in the absence of sort of government support or action in some areas, or direction, sometimes people just get to doing the work through a shared belief and commitment. And very much this idea of community has become the success story that our country tells about the pandemic, with sort of leaders and the Prime Minister himself calling on the country to continue to exercise these spirits of togetherness and commitment as we move into the second wave. And as part of that shift and transition, the Prime Minister commissioned Danny Kruger, an MP, to develop proposals to try and sustain that community spirit. And this led to the production of the Kruger Report, which was titled Leveling Up Our Communities. And for me, this report actually presented an incredibly positive rhetoric of what community could be in this country. It started to in some ways respond to some of the challenges that we saw manifest in other outbreaks. So as this quote on this slide highlights, that we think about community by stitching together communities of identity in the same place, in the same community of place. So acknowledging that community of place is insufficient in and of itself to make a difference. We must think about the other ways that people make sense of themselves in a place. And also about power. So very much this report reflects on the importance of following some rhetoric with resources. Mostly the discussion is around material resources. So the establishment of an endowment, which would values of £2 billion, which is a fund that is to guide investment in sort of community transformation projects across the country, the importance of dealing with sort of historical inequalities in the country between the North and the South, and how we can use this type of work to do that, and very much beginning to reflect on the positive capabilities of communities in this country. But I think one of the challenges that remains is that it has an insufficient appreciation of what is required to do the stitching together. So there is mention of things such as inequality, but largely that discourse of community of place holds on to it. So the discussion of inequality is about the inequality between the North and the South of the country, rather than acknowledging that within any part of the country, some groups have access to more resources than others. Some people are bound by sort of structures and basic needs and realities that make participation more or less likely in these processes. There is mention of the specific need to reach out to historically excluded groups, such as Black Asian, Black Caribbean, Black African, and Asian communities in this country, but no acknowledgement of what would be required to enable that type of participation, or the importance of redressing some historical oppressions within these groups that might limit their engagement in these types of spaces, or their ability to participate in this grand idea. And I think ultimately the overwhelming feeling of that one gets from this report is that there is an idea of trying to get people to feel part of a community of place. So we remain anchored to this idea of community of place, without acknowledging that feeling part of a community demands more than just being invited to the table. You have to feel that you are able to meaningfully contribute to the discussions that are happening at that table. And that might require different types of work. And so in the final part of my talk, I'd like to reflect on how we could get there. How do we take advantage of the amazing possibility created by this pandemic and the development of a report like the Kruger report, and the type of rhetoric that talks about communities in slightly more complex ways, making acknowledgement of things like resources as really important to change. And I, as I said earlier, I feel that this becomes possible through positioning community as a site of transformation across levels and ways in which community could be defined. And so this is very much anchored to the work of Nelson and Plotensky, who are community psychologists who have sort of written sort of a very long body of work about what makes community psychology special as a discipline, and ultimately highlight that community processes are pathways to liberation. So as a discipline, it starts from the acknowledgement that many of us in some way, shape, or form have experienced oppression in our lives. And the work of a practitioner or a researcher or an activist is to understand these experiences, try to understand these experiences of oppression, and try to then work in solidarity with people to achieve their well-being through redressing the sites of oppression. And through working on those levels, these sort of structural limitations in small ways, medium-sized ways, and big ways along people's sort of journeys, then we begin to help make the world better. You know, sort of this image here is one that really highlights for me what is the idea behind community psychology and transformation, is keeping room for the unimaginable and trying to ensure that our engagement, whether it be as a researcher or a practitioner, creates space for the unimaginable. And so how might we go about doing this? So this is an adaptation from their framework on transformation and what we need to do to move from traditional approaches to transformative ones that work across the different methodologies that we work in. So you don't, if you're a researcher, it's not about qualitative versus quantitative, but about the types of questions we ask and who's involved in defining what those questions are. So they start with some key assumptions and practices that are bound up in engagement with communities. The first is defining the problem. You know, when I started, I suggested that many times with communities, who the community is defined from the outset rather than in collaboration with the people who could potentially make up a community. And some of the traditional approaches to that then root on, or often rooted in, individualistic ideas or philosophies that can result in sort of victim blaming. And so this might be looking at communities as individual entities in isolation rather than acknowledging the way in which all of them fit together in different networks. A transformative approach conversely says that problems should be reframed in terms of wider contexts and diversity, in this idea of complexity of the problem, and allowing us to use tools that enable us to do that. The focus of the intervention or research shifts from the idea of a deficit or a problem. So within COVID-19, when we talk about specific communities, we often talk about how vulnerabilities alone. So we talk about how this group is more likely to die than this group, and how this group is more likely to be excluded than this group. And these are truisms. They're true. Oh, apologies. This is my trigger to make sure I don't talk for too long. They're true, but that's only a partial truth. And so a transformative approach acknowledges the challenges and the problems because you acknowledge the fact that oppression or marginalization exists, but a big part of your interest is also how people survive through that. What are the competencies and strengths that people have? What can be done in order to allow them to build on those existing resources? And so the focus or the goal becomes empowerment through your engagement, and empowering people to be able to make changes in their own lives through the proxy of your engagement or collaboration with them. That should build from a starting point of what people are already doing in their everyday lives to survive. So the goal isn't only the reduction of maladaptive behaviors and thinking about what people are doing wrong, but thinking about what they're doing right and try to promote more than that. In order to do this, you need to also then reframe the idea of the participant or a client or a service user as somebody who, more than who just complies with regulations or systems or structures, but somebody who is an active participant in developing those structures, recognizing that people exercise choice and have self-direction, and often that choice and direction is decided by their need to fit in with lots of these different dimensions of self that connect them to all these different communities. So the choices that I might make, for example, as a mother, and how that fits in with compliance to other spaces in my life. So accepting that, that relationship as something that is important. And again, in terms of doing research, the reality is that your research is much more open. You ask wide questions that are subject to change depending on how communities sort of reflect on or see the relevance of your question, and sort of really trying to acknowledge the existing knowledge structures that exist in various communities through the proxy of their lived experiences, which contribute to survival and well-being. So the first of the two projects that I'm going to talk about is this piece of research that I've recently done in Southwest London with my key partner and a partner in research for many years, the Wandsworth Community Empowerment Network, and our efforts in trying to make sense of how young people have been surviving through this very stressful time, and how what we did tried to make space for their survival. So not just to understand what was difficult for them, but also to uncover and highlight possibilities for change and what was going well and how they were coping and surviving. And we did this work in a qualitative study with around 40 young people, and we used 40 young people from sort of Black, African, Black, Caribbean, and Southeast Asian backgrounds. And we used a method called story completion. And this is a method that allows us to unpack and reflect on the different cultural or discursive frameworks and narratives that young people use to make sense of the world. And we did this, and part of the study, they made 3 stories. So the first story had a stem, which is sort of the introduction, a couple sentences, where a family is watching sort of the Prime Minister's updates, and then trying to explore how a family feels during this time. And so many of the usual themes that you would expect to see around these communities are highlighted in that stem, talking about financial pressures, wider worries about sort of family well-being and resources, but also that what came up in that stem was highlighting how young people are sort of push and press themselves to achieve and survive and succeed despite these current challenges, and the ways in which they were doing that, how they were coping through making new networks with friends, reconnecting with family members, and wanting those things to continue as sort of lockdown had ended. And the second stem, which explored sort of perspectives around health communication, engagement with government messages, and also engagement with more of what is often what is called as conspiracy theory around COVID-19 transmission, which is around 5G. And sort of what this really highlighted were tensions young people experienced in trying to know how to act. So on one hand, not feeling as though they could make sense of government messaging, trust government messaging, and then trying to balancing against the need to protect their families and why that was so important to them. And this sort of is balanced then against sort of talking with friends around sort of like local knowledge, conspiracy theory, about this idea of 5G and what happens when you sort of believe or don't believe these ideas, and how that creates tensions for you in other spaces. So some stories about friends rejecting them because they sort of try to say, actually, that's not the case, that's not true, and how that leads to sort of a loss of a key resource for them, which is sort of being excluded from friend groups. And so really highlighting the tensions with trying to maintain responsibility to family and friends, and also a collective society that sometimes in the third stem really emerged that young people don't feel is for them. And so this stem was the most difficult one, and I'll spend a bit more time going through it because of that, but it highlights the possibility for an encounter with law enforcement for young people in the story. And young people, in telling new stories and finishing stories around this, highlight a few things that are, I think, really critical to understanding in terms of trying to think about behavior and good behavior and social change in the context of recovery. So one story pathway was very resonant of the historical treatment of Black people and people of color in this country in relation to policing. So there's consistent data that shows that people of color in this country are more likely to be under surveillance or policed or, you know, experience stop and search. And this was also resonated very much with our young people, all who were leaders in their communities, you know, succeeding at school, many of them sort of doing A-levels and then being caught up in the A-level, lack of a better word, fiasco earlier this year. And ultimately really still having these experiences of mistreatment and very vivid accounts of stop and search encounters. And what is possible for them to do in the light of the histories of this kind of treatment and this kind of reality highlights the importance of trust in this current pandemic and how some communities just don't trust the systems that they relate to for very good reason. And so one young person spoke of their previous stop and search encounter in relation to making this new story, and said this phrase, you know, I thought they've got my name. I'm a criminal, my nice clean name. I don't need that anywhere. And sort of highlighting what the fear of what happens when a system has you on record unfairly. You know, this is an account of a young person walking home from school one afternoon. And how does this fear of what happens when somebody has your information and what that means for your future, a future where you're projecting a positive sense of self, how does that become encounter with systems like track and test and trace, where you need people to trust and believe in a system to give your information over in order to do appropriate public health surveillance? This is the type of understanding that sort of highlights why different procedures and approaches will be needed in order to get certain communities to participate in these measures that we're trying to develop for and potentially target to those who are potentially most affected. And the second pathway of stories, which was really inspiring, was that they didn't always end in bad endings. Even in the stories that started out quite bleakly, there was always some sort of hero narrative where a space for trust can be repaired and apologies are made. Communities come together to protect each other, sort of people band around young people and try to plead the case of them just being children, to sort of reject the stereotypes that are being put forward. And this really highlights to me something that resonates with Langston Hughes' poem, where he asks the question, what happens to a dream deferred? And I think basically our dreams are carried on by the young, and the young, despite having negative encounters, still have that hope for things to be made better, and that better is possible. So this ultimately creates a space for newness and change and hope, and for us to work to develop new environments where good, healthy behavior is possible. And for the next group that I want to talk about, I just want to let the women speak for themselves, if you will allow me. This video is quite short, it's only 4 minutes. And then after that, I will wrap up and then we can have a discussion and later some questions. So.
Throughout COVID, some of our incredible Southwark women have been holding themselves and their communities together in tiny ways and massive ways. This film is celebrating the generosity and creativity.
Hi, I'm Lisanne. This is my lockdown video. During my lockdown, I'm going to be doing my garden. As you can see, I've done quite a bit of it already, but I haven't got a lot of money, so I'm having to do it how I can.
Women of Southwark have been gardening, they've been making, they've been helping, they've been feeding the less fortunate.
COVID has already taught us to help and support most vulnerable people, especially the elderly people and the family with a low income. So I step out and then I support them by giving out a lot of food in my TRA, and then even in my faith group, I call them to check on them. Do you have anything to do? I've already done one this morning. I call on Rita, do you need any help? She wanted me to do the rent, which I did. She told me, Saida, you make me feel part of the community. And that's what really touched me.
a service, as a women's centre, we run a lot of creative activities for women, and we know that those things are really vital for our well-being, for self-care, for looking after ourselves. And we've been doing weekly reading groups, self-care groups, therapy and spoken word groups online, which has released incredible reflection and processing of everything that's been going on for women.
COVID has made individuals and organizations reach out more than we were doing in the first place.
People who we weren't aware of before, who had problems because they stay underneath the radar, we are now aware of them.
But listening to what people are saying, trying to be able to feel what they're feeling, and then be able to reflect and see how you can improve the situation together.
We started running things like Zumba classes. Women just join energy from each other to exercise and feel good about themselves. That can help us to develop a positive mindset. I put up together some regular weekly workshop focusing on, gratitude. It's good to practice gratitude because it allows you to see the good in others as well as the good in you.
This lockdown has made me think a lot about. I had a good chat with my mum. We've been in contact now over a couple of months. She rings me once a week, and it's nice to hear from her. We never used to get on, and it makes me think that hopefully when my daughter comes home that she can feel the same way as me.
As the world continues to struggle with COVID, the women of Southwark are turning the negatives of the crisis into positives for their future.
I think that we should remember that we're still in this together.
Respect and honoring different members of our community.
Awaken your spiritual self.
Holding on to how good we've got at checking in on each other.
We should love, we should care, and we should share.
What we have already told us how to can embrace one another, how to can support one another, because we are in a new world now. So we need to support each other and to bring a new mindset in the community.
And it's time for us, I can't overemphasize that we start realizing that we all need each other in this world to make it a better place.
And I think what that video captures so beautifully, and it's been shared with us today by the sort of kindness of Felicity Reed, who is the head of Pause Southwark, and Ola from Ladies of Virtue, who are sort of spearheaded the development of this video to really try and tell a story of what women were doing who were often sort of defined by characteristics that link them to marginalization and oppression. And in many ways, a video like this highlights the ways in which people are so much more than the ways that we try to define them for the purposes of intervention. And so they sort of really recognized that the strongest and most energetic activities in communities were coming from these women who are often described quite differently in literature and policy documents. And despite being in positions recognized by power, they have the ability to leverage languages of love to open up opportunities and spaces for caring, and ultimately redefine boundaries of communities in the places where they live. And so each of these different women's organizations actually reflect a different slicing of community, if you will, within a shared space of Southwark. And, you know, what they bring to the table is something so valuable in terms of being able to speak not just to the groups that they come from, but across groups as well, and sort of finding points for sharing. And the ways, and one of the great things that sort of come out of this work and the development of this video is that they're going to be developing a network of women in community across these different different dimensions of personhood and different dimensions of community, to have sort of a shared space for developing practice and elevating local expertise and bringing that to bear in the third sector and in more formal service spaces as we move forward during the crisis. And recovery. So just to wrap up, ultimately what it feels like I've been building towards saying is that I'm in, very rarely say this, in very full agreement with sort of some of the ideas that have been put forward by this most recent report on communities, the Kruger report and its proposals. But I think that in order for this to be more than just a really beautiful document of ideas, there needs to be some shifting and some changing around this idea of community. And one of the ways we can do that is to really maintain the idea that there are points of action that will unite different communities across the country or across shared spaces, in more sort of smaller geographical regions, around some of the big structural inequalities that create oppression in the first place. And none of the change that needs to happen is possible unless some parallel work is happening in those spaces. And so community mobilization and activism on various national, local, regional levels remain incredibly important. And those types of spaces need to be supported as much as as much as the creation of sort of new systems for structure and change. I think another big part of this, it will be to make sure that we start telling different stories about communities, change our narrative that sort of makes sure that we talk about communities in more complex ways, that doesn't just stop at the oppression, but also highlights the ways in which communities survive and uses that survival as a platform for change. And ultimately, finally, to think about power in a much more complex way. Nelson and Pratinsky outline about 10 different dimensions of power that they consider relevant in community contexts, but there are 3 that I think are particularly useful for us here during COVID restructuring. And the first is to understand that power is something that can apply individually to others in sort of intimate relationships, and more broadly to collectives and across collectives. And so recognizing the different levels at which community operates and how power operates within each of them. Number 2, that power ultimately gives us multiple identities that can lead to us experiencing oppression on one hand, but being an active agent and engaged in emancipation in another. So to realize that power is very much about both our ability to resist things and also our ability to change things despite experiencing oppression. And finally, to recognize that structural factors have the power to act on people and limit their ability to make use of power in their lives. So structural factors such as social class, gender, race, sexuality, and ability mean that people enjoy various levels of access to power that we try to free up in different ways through economic structures or developing new governance structures at the level of community. But ultimately, I definitely feel that we are at this threshold of something different and exciting and new. And even at the heart of all these intersecting crises around the world, I've still remained very much an optimist, for better or worse, in terms of my relationship to it. And I think this is because of how I think about community. Paulo Freire, who is a sort of sociologist and scholar from Latin America, would talk about this as a pedagogy of hope. And maybe this is the case, but ultimately what I see is that there's very much a belief in many spaces in these case studies that community can offer us something better, that there's hope for something better. And so I think that partially explains why I hold on very tightly to a quote by Arundhati Roy, where she says, "Another world is not only possible, she is on her way. On a quiet day, I can hear her breathing." And I think that is very much the case for communities all around the world who are pushing and making their way through in search of something better. And I think that if we give time and act on as many levels of community to change things as possible, we will get there. So thank you very much for your time and the privilege of your time today. And I will say no more. I'd like to hear other people talk now. So thank you very much.
Thank you so much, Rochelle, for a very inspiring talk. And there's lots in there that I would like to pick up with you, first of all, before we open to the floor.
Yeah.
Before I do, so everyone in the audience, please could I just remind you again to submit your questions using the Q&A box. This is something that will help me enormously. So if you could do that, I'd be really grateful. So Rochelle, there are a whole series of issues here, some of them specific to the UK and some of them very much broader than that.
Mm-hmm.
So in the UK, we have a problem, I think, between understanding what we mean by community because we think it's so place-based. So we talk a lot about those who are left behind without actually including any of the people who really are left behind in that statement. So, and here we have a problem with, because we want devolution of power down from central government. So we have a problem here about what's the relationship between national government, local government, and community. And actually very often local government isn't necessarily always working on behalf of community. So how do you see that? How do you see that sort of process in the UK in the work that you've done?
Yeah, I mean, I think it's really interesting and really it's really difficult, because in the sense that what we talk about devolving power, but only in some sense of the word.
Yes.
So particularly when you get to sort of local levels, there is this, the power just feels more symbolic and positional. And I think a lot of efforts in sort of local councils for people to work with more grassroots community organizations or third sectors to make change locally is constrained by the inability to devolve resources with that type of power. So you can make as many decisions as you want, but you don't have any money to put anything into action. And so what happens is it creates a very sort of unfortunate tension, I think, between very local government as they become the face of insoluble change. They just sort of become the face of like the no. Despite the fact that their hands are often tied. And I think also a lot of times like this sort of, the ideas that we have around local governance are very much reflective of sort of not the modern manifestation of the UK and Britain as I would understand it. So it sort of, it doesn't acknowledge diversity that exists in these many local spaces as much as it should. So if you think about London, for example, and Islington, where I used to live before I moved out to a home county, as I now know they're called, it was one of the most unequal boroughs in the world, like some of the highest levels of child poverty, but also some of the highest real estate in the country. And so I imagine that those two groups feel like they're represented in very different ways by their local government and even their MP as you move up. And so these sort of, the ways in which our power structures work don't give space to sort of serve two masters, as it were, because there's so much inequality in this country. You kind of need, like, those two systems don't coincide with each other. You can't serve both of them at the same time, in my opinion. And I guess what I found most interesting about the Kruger report was this new structure of community governments that they wanted to create, where local grassroots communities, in theory, would be given decision-making powers in their local areas, so that they wouldn't have to go through those other hierarchies to act. It sort of like subverts it on sort of temporary basis, but there wasn't a lot of detail on how that would work. I suppose it would need to be explored further over time, but it seems to be that report acknowledges that the very local level of government isn't working, and also acknowledges that it's also about money, and talks about where we can find that money from. Which I found really Yeah, I was reading this thing and I was like, am I in a parallel world where this is very great for the most part, you know, it's a nice starting point. And that might be why it didn't get much media attention at all.
Yeah, well, that's probably true. So probably sank like a stone because they.
Yeah, it's like you heard it once and then nothing else.
And that brings me to another point that I'm very interested in, which is that the kind of stories that we create about ourselves and that grow up around ourselves. So, for example, communities are very often undercut by the way in which we've divided the world up into categories.
Yes.
So at the moment, this notion of the vulnerable is one, of course, and of course that is a multi-composite category in itself. But now we're talking about youth again, as if we understood what youth was. We keep talking about youth. We keep talking about the elderly, of whom I'm one, apparently. Yeah. I mean, so, you know, all of these strange categories which we're in. And of course, the thing about these categories is that they direct the financing.
Yeah.
So very often there's a problem here about the relationship between community and category. I mean, have you encountered that in your work?
Oh yes, very, very much so. You sort of bring up this idea around youth. In trying to, and the way youth then intersects with vulnerability. So how do you think about making plans for the needs of young people? And where do you cut young, right? Yeah. So trying to do this research, it's like, okay, so once you do research with young people, we're going to go 16 to 25. Yeah. Why 25? In a community where young people are most likely to still be living, very likely to be living with parents, to have inflexible income sources. That means that they rely on their parents for a lot of things. That means that their experiences of vulnerability might mean that they are progressing through education pathways at different rates or different. So these numbers, as you say, become quite meaningless. Yeah. And in reality, what I think would be preferable is if we set these categories based on experience rather than numbers, or, you know, so that when I talk about youth work in Southwest London, when I'm working with young people of color, then that work can go up to the age of 30, because there are still young people who are finding their way through these systems development that's been interrupted by loss or experience in juvenile detention or any types or anything that could happen. And that's not just in sort of communities of color, that can also happen in sort of low income communities that just intersect across all different sort of races or class. So I think if you look at experience rather than sort of, you know, numbers or categories in the way, as you said, it sort of opens it up a bit more. But it's a much slower process to define those categories. And I guess we highlight that tension between, do we want to work in the world as it is, or do we want to ask questions that will get funded?
Yes.
Right. Yeah. Right. So you sort of, yeah.
Yeah. Yeah. There was just one point I wanted to bring up as well, which relates to your work more globally. Because one of the things that I was very struck by is that when we entered this pandemic, the one thing we didn't do was to ask the people who'd had experiences of pandemics in other parts of the world recently, what they had done at the community level. So that would have meant talking to Sierra Leone, Liberia, and a whole lot of other places whom we don't normally go to for kind of advice. And of course, we didn't do that. And they had worked out how to manage these things at the community level. So there's a whole excuse me, global north, global south divide thing here going on as well, understanding, you know, where you can respond to your community. And in a way the global north doesn't, or it has a strange idea of what it is.
Yeah, no, I agree. There's sort of the global health field as a whole is still very much anchored to the remnants of colonialism, and at least ideas around sort of like who is responsible for taking care of whom. And the power of those ideas, I find often results in the types of practices that we see. So the ways in which that discourse creates our behavior. And so it wouldn't even occur to ask those questions because you think that your job is to release funding for them rather than to go to them and say, you've done that, you tell us. And sort of this idea of where innovation comes from. And there's this term that I came across the other day that or not the other day, months ago now, which I just thought really highlighted the ways in which we struggle with that, which is something called reverse innovation.
Mm-hmm.
And reverse innovation is what it's called when the global north gets ideas from the global south. And the fact that we put reverse in front of it really encapsulates the problem, right? It's just innovation.
Yeah, exactly.
It's just innovation. Yeah. And that also speaks to the idea of the community as something that's out there, maybe, and not something that happens to all of us. Yeah.
It's really interesting, isn't it?
Yeah.
Well, I must not hog the floor anymore because there are a lot of questions coming down the line for you, but perhaps we can find another moment to talk about some of these things. But anyway,
yes, of course.
First question is from Jackie McGlade, and she's asking, is there any evidence that having multiple identities and belonging to many communities affects the mental health of the individual?
I mean, that's a very good question. I think one way to answer that would be to look at how access to many different forms of social capital relates to good or poor mental health, because you gain social capital through relationships. And so in that sense, people who feel positive affiliations to many communities then gain something positive from those affiliations in terms of well-being. If you look at social markers of well-being around sort of thinking about sort of collective identity and collective success and solidarity, and these are often markers to people feeling sort of that they have social well-being, which is linked to good mental health. So potentially, if your affiliations are positive ones, then it will increase the positive value from that capital, social capital. If you're affiliated to lots of different communities where they're sort of potentially stigmatized communities. So if you think about groups that are maybe traditionally excluded, so if you are poor and a woman and have a disability, then those markers and the norms that are attached to them in society might mean that those connections don't give you any positive senses of self. Yeah. So I think it all has to do with how people feel in terms about the value of those relationships and what it means to them. And it makes me think about a really amazing paper by Caroline Howarth again, where she did lots of work with communities and young people in Brixton. And one of her favorite papers of mine talks about what it means, how people make sense of Blackness. And one of the quotes from that paper is, "It's only other people that make me feel Black."
Yeah.
So the way in which the other sees you carries the currency for your association to a group, and then how you then just start to feel about it. And so that's the point of that idea about how we are all co-constructed by what we think about ourselves and what that means in the world that we live in.
Yeah,
that's a really great question.
So the next question is from Roman Malin Hiscock, and he's asking, what is your position on the growth of certain online communities, in particular those that stem from conspiracy theories, which you mentioned, or support prejudice and discrimination? In your view, how do they impact the nature of community in the offline world?
Yes, I mean, that's a really good question. I think when we think about those types of communities, the thing that we often forget, but is really important, is that they serve similar processes for those people who are in them. So it is a collection of individuals who have a way of thinking about the world and finding other peoples that validate that, and then sort of develops their well-being and feelings of place and personhood in society. I think it's really difficult because I obviously think that there's a lot of really important work to be done in thinking about conflict between communities and how communities ultimately hurt one another, can spread disinformation, can potentially bring harm to a sort of wider level of community as a global community. And I think that sort of leads us to thinking about how other dimensions of things like justice and fairness intersect with how we make sense of society. And so we can understand why communities exist, but then when your actions contribute to the hurt and harm of others, that is a problem. And so it sets in motion other types of responses and practices. And I suppose in the offline was the question about the offline world or the online world?
Well, how the online affects the offline.
How the online affects the offline. And I mean, it definitely does affect the offline. You know, there's a lot of growing evidence about how overconsumption of sort of online spaces can contribute poorly to people's emotional well-being. So, you know, people on Twitter too much and then they leave and they're like, oh my goodness, I feel much happier. And the way that certain groups on Twitter experience more kinds of abuse or more frequent abuse from different groups, and that is taken away in the real world. So how I am treated, you know, and how I engage in the online world, I can say personally for me, definitely shapes how I behave in my offline world. So I see, you know, if I self-police my behavior online to reduce the likelihood that I'm going to be trolled by racist trolls,
yes,
that generally then increases my anxieties in the world around me when I see you sort of link into sort of the way in which you assess situations in the real world. So if I'm in a space that I'm concerned that people might be racist, what do I say? How do I engage in that space? It changes. But I think those things are related because for better or worse, we live in online and offline worlds now. You know, we are very much a part of both. I think it's just about learning about how we will get better at, I think, policing the online worlds in ways to make people safe in a way that we theoretically do in the offline world, but it's much newer, so it will just take longer to catch up, I think.
Yeah. No, I think we have just a very brief follow-up on that question, actually, from Nikolai Mintchev. And since Nikolai's a panelist, he can ask you himself. So there he is.
Hi, thank you, Henrietta. Thanks, Rochelle. My follow-up is about, so in this case, how do we deal with the divisiveness and with the fact that everything nowadays seems to be politicized and seems to have divisive potential? Are there forms of community building that can help us mitigate for that? Because, you know, if now face masks are all of a sudden divisive and, you know, vegan sausages are contentious, not to mention Brexit, what do we do and what kind of community building practices do we need to redress this state of affairs?
It's a really big question, but a really important one. I think it sort of comes to this idea about that I had when I was wrapping up, where I said we need to tell different stories. So I think in terms of creating a collective consciousness where we don't only hear about conflicts between groups, I think the way in which media sells and works, oftentimes in this country, the most, and all over the world, is the most exciting story is the one with the most conflict in it. Nobody's gonna sort of write a headline news story on the BBC News about these women in Southwark.
Yeah.
But they should, because what's happening in that community is really highlighting how we are working across class and ethnicity and religion and age and all of these different categories that could divide us to do something different. So I think the more that those stories become the common currency rather than the exception, is that we start to imagine that something else is possible. Because community, we create community. That's the thing that is the positive about it. So we can create new communities in new places for new purposes, but we have to think that they're possible. So if I don't think that I can be friends with somebody who voted for Brexit, then I will never be friends with somebody who voted for Brexit.
Yeah.
But if there are imaginings or like spaces to imagine the ways in which we are similar, you can have different kinds of conversations about things and sort of rather than combative kinds of spaces. So I think it is about trying to map out diversity, because in mapping diversity, you find new convergences that sometimes move us around the more contentious things.
Yeah.
Yeah. That's a wonderful answer. And it's also important with Southwark, I think, to remember the very, very long history of community activism in Southwark. That's one thing. I mean, we go back, at least in my experience of Southwark, and actually working with those groups, to the 1970s. So, and probably for what all I know beyond that. So that's a long history now. That's 50 years. So
yeah.
Henrietta, could I have another follow-up?
No, you can't have a follow-up because I promised to follow up to someone else. Okay, so hang on a sec. Hang on, we'll see how we do.
Can I just also say, Henrietta, on that point of history, that is the thing, right? Like I feel like a lot of times our ability to imagine is connected to knowing the history of a place.
Yes.
Especially a positive history of a place. And so in Southwark, that energy and that history feeds more and more of that type of action.
Yeah. And I'm very aware that Dr. Burgess has to leave us at 5:30. So let me, Nikolai, apologies for cutting you off. Let me just return, Rochelle, if I may, to a more sort of structural question in a way. So this is from Saffron Woodcraft, and she's asking you about reflections on the Kruger report and its lack of attention to structural inequalities and barriers to participation and power, which is so important at the moment. And so she's asking, how can the transformational notion of community that you present be elevated and embedded in policymaking? And by that she means, how do we do this practically? What kind of collaborations do we need with decision makers for the long term?
Okay, that's a really excellent question. And my answer to that is twofold. I think first you need the discursive space to be created for you to do it. So the existence of this report, even an imperfect version, creates a space to talk about doing it.
Right.
Because you have an ability to respond to something.
Yep.
So without this report, it just gets really hard to bring these kinds of things to the agenda. So for me, the most important step is this first step of this report existing to say communities are the way forward. Because the response is, you can't get communities to do anything if you don't think about inequalities that are structural in these communities. And one of the other things that would enable us to do that type of work practically, I think, resides in sort of co-production and co-design methodologies. They are, in health services, they are often talked about sort of like PPI, but what's different about a co-production strategy that's done critically and importantly is that it tries to engage in long-term discussions with all these different groups who have experienced these different types of structural inequality to be there and to talk about that experience. So some of the work I've done in London has been evaluating a program that has done co-production around reducing mental health inequalities. And that work took 10 years. But the result of that 10 years of work was that they were able to produce programs that actually started to reduce the inequalities in access to care. And in that 10 years, they did really important things where they recognized symbolic power of historically oppressed communities, statutory services, made small investments in the efforts of different communities to come together to do work to change structural realities, looking at different systems like social prescribing and what that might have to offer in terms of widening the remit of the social in terms of responding to distress. But being able to work through and talk through those ideas required 10 years, required leaders who were willing to sit and listen to the ways that they had harmed communities and own up to them and apologize for them. Like, you know, like the end of that story from the young people in my study, where there is ability to apologize and repair trust when you admit and acknowledge that what you've done in the past is wrong. And then a real relationship can evolve from there. So I think, I mean, I'm happy to be contacted offline if people would like to see any of these reports or these papers. Some of them are under review or in press, so they're not on the reference list. But really, co-production to me is a methodology that would enable you to start to shift agendas meaningfully, because it also starts to shift the thinking of the people who make the agendas through engagement and proximity to the people that they have been talking about, making a new relationship and working with them rather than on them.
Yes, and very sadly, I see that we've arrived at 5:31 even, so yes. We kept you 1 minute longer than you needed to be kept. And we have a lot of questions still in the chat line, which we will follow up with. And but thank you so much, Rochelle, for a fantastic talk and for inspiring all these wonderful questions. And I love the video. I really did love the video.
Yeah,
it's a great pleasure to have seen you today, and we wish we could do this in person. But I hope that we'll link back to you at the IGP. And so now the panelists who can unmute, which they have done, I'm just going to give you a round of applause. So.
Thank you so much.
Thank you very much. Thanks very much, everyone. See you for the next Director Seminar in 2 weeks' time. Thank you very much. Bye.
Bye.